Mystic Radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Welcome, everybody, to Live with Dr. Carolyn Dean here on AchieveRadio.com. This is Ginny Gunther, also known as Ginny Almighty, and I'll be your host tonight, too, along with Dr. Carolyn Dean.
Phone lines are now open at 602-666-6027. That's 602-666-6027.
We'll be taking your phone calls from around the world and right here in the U.S. Welcome, everybody. It's Monday, August 1st, here in the eternal timeless state of 2016, and you are listening once again to Live with Dr. Carolyn Dean here on AchieveRadio.com, and I say once again because we have so many people who tune in week from week, but I don't know, perhaps you're a first-time listener, in which case, welcome to the show. You'll be thrilled and delighted to spend 2 hours with one of the most amazing and influential natural doctors on all of planet Earth, our very own Dr. Carolyn Dean, who has been at this for a very long time, not only as a medical doctor and a naturopath, but also as an herbalist, an acupuncturist, a nutritionist, an intuitive, a lecturer, consultant, an author, and an inventor, specifically of the complement formulas, including the RNA drops, which is a barley extract harboring a newly identified cell called the I cell. She also created the first non-laxative, 100% absorbed, 60,000 part per million, 99.99%, totally pure elemental magnesium in her Remag formula, and the multiple minerals called Remite, as well as our wonderful Cinderella product Realign, down in the basement, taking care of the liver while all the other people party at the ball. And she receives awards, accolades, recommendations, and not only that, but she receives testimonials week after week, like one or two you'll probably hear peppered throughout the show this evening, just talking about the amazing results that people are achieving when they finally get the proper size molecule of magnesium directly into the ion channel of the body so that they can produce the extraordinary results that the body needs through magnesium saturation. We're so happy to have her here this evening, and she's going to be talking once again about not only how you can take better care of yourself and enjoy your life more thoroughly, but what you can do with your emotions, your spirit, and just your general environment to improve every single aspect of your life. Thank you so much for being with us again, Dr. Dean. Welcome, Dr. Carolyn Dean.
Yay! Thank you, Ginny. I don't have much to say today about your introduction because I want to do a vindication dance. You know what I'm talking about.
I have been dancing all day long, girlfriend. I have been waiting for this moment. So by all means, you get busy. Go, go, go.
All right. What this is about, and I do wish I could sing. I'll get Ginny to sing something later about vindication. And I mean, we're just kind of joking here about my latest blog. I had blogged Saturday about, early Sunday about Dr. Mercola going into his 20th year on the internet with his health information, so I was congratulating him. But then I came across this article in Medscape where I get a lot of my information that I just blog and sort of rant about. So this second blog that I did just last night, it's about atrial fibrillation possibly being a placebo, and atrial fibrillation ablation being a placebo. I'm sorry, I'm a little bit distracted. You might hear the noise outside. They've decided to do our lawn care right at the moment I start my show. So hopefully you're not hearing too much of that, Ginny. So what I blogged was about a doctor, a medical doctor, a cardiac electrophysiologist practicing in Louisville, Kentucky, and he's been doing atrial fibrillation, cardiac ablations for 12 years. And because he has a blog, a website, and everything, I was able to go back and look at his previous posts. And I wondered how he come to this realization that the cardiac ablations he's been doing to try to damage the site of atrial fibrillation in the heart, to try to, kill those cells that are fibrillating. I wondered how he decided that it was no longer working, in his opinion. And it seems that back in 2012, he's all gung-ho. He writes in his blog about how much easier ablations have gotten with the new technologies, and he's doing more and more procedures than ever. Then in 2015, he writes a blog called A Cautionary Note on AF Ablation. So it turns out he's doing fewer ablations because he says the drugs and or the ablation fix aren't working on everyone like they should, he says. He talks about a new way of thinking about AFib, where cardiologists say that it seems to occur, AFib, seems to occur as a sign or symptom of something else. And he says he's surprised that he and his colleagues took so long to figure this out. Turns out they've only been doing AFib cardiac ablation for 20 years. So the factors he lists that may be triggers for AFib are obesity, sleep apnea, alcohol, high blood pressure, inflammatory conditions, infections or trauma, excess exercise, and stress. He says that most experts now agree that each of these conditions, either alone or together, create the milieu in which AFib starts and perpetuates. Now that's huge. That's a huge admission there. As Ginny said to me in an email, it's amazing and wonderful to see a doctor recanting. And this is true. I mean, I haven't gone there today, but Ginny, if you could go to his site, click on A Cautionary Note on AFib, and find the AFib. It's on Medscape.
It's on Medscape. I can't get on. Yeah.
Yeah, I'm a member, and you all can be a member of Medscape. It's free. I find when I put in my Medscape URL in my blogs that you just get to my page, and you have to have my password. But let me, maybe during the show when I get a minute, I'll look and see what the comments are from other readers of this blog about AFib ablation being placebo, because I'm sure doctors are just incensed if they haven't been looking at these lifestyle factors. So in the blog I go on to say, unfortunately, this doctor gives no thought to the fact that since AFib is an electrical condition, why not look at the electrolytes, especially magnesium? Instead, he just says that the above conditions, with inflammation and excess being the common thread, excess alcohol, obesity, etc., being the common thread, cause atrial chamber dilation, enlargement of individual atrial cells, loss of atria skeleton, change in cell membrane connections, and deposition of scar. Now that's all. That to me is all kind of made up. It's like, I don't know if that happens. And, when you look at what he says about hypertension in there, I mean, a lot of these people are on medications, and I'm saying over and over again that, well, you keep depleting your magnesium and throwing off your electrical conductivity, and that's what makes your heart irritable. It's like the irritability you feel when you get a headache and then a migraine, irritability that keeps you from being able to sleep deeply, irritability and tension in your muscles and nerves from magnesium deficiency passes on to your heart. So he says that since embracing this holistic approach to people with AFib, he's saying these words: I've done far fewer ablations and redo ablations. The take-home message for patients and doctors alike is that AFib ablation remains a reasonable option for carefully selected patients, but we should no longer rush to treat a condition caused by scarring by creating more scar. And that's what they're doing. He's saying that there's damage and scarring and stretching and, the skeleton of the atria are all messed up and scar forms, and then that scar irritates the heart's pacemaker and causes a fibrillation. So then I get to the actual article in Medscape, June of this year. He gives it all up, and his Medscape post reads, "Could ablation for AFib be an elaborate placebo?" He says that AFib ablation has never been properly tested against placebo, and cardiologists are beginning to question the procedure. His concerns seem to have been triggered by a trial of a more invasive ablation procedure to prevent recurrence. So, the ablation procedures they've been using haven't been uniformly successful, so they're doing deeper and deeper scarring. And he said that the German authors called their 2-year results after a cryoballoon ablation in patients with persistent AFib promising. How promising? The procedure failed in 22 of the 50 patients, so that's 44% failure. Not only are the results poor, but the procedure is big ablation lesions in the left atrium, only millimeters away from the esophagus or the phrenic nerve. They use general anesthesia. They puncture the septum of the heart. They use multiple vascular entries. There's hours of bed rest, putting patients at significant risk. And then he repeats, creating a scar to treat a disease that is often caused by a scar hardly seems elegant. I told people to go to Medscape, become a member, and read this paper. As I said, it's been around for 20 years. I said, perhaps it's like many other therapies that have had great success in the beginning because of a huge placebo effect where everyone's excited, no, it's a new procedure, and then over time the effects wear off. The doctor even says that because AFib drugs have so many side effects that, and I quote him, in a comparison of ablation versus drugs, the ablation procedure could be neutral but look positive relative to the drugs. And he asks the tough question, is it a stretch to posit that an antiarrhythmia drug worsens symptoms when it converts intermittent AFib to sustained flutter? Now, that's a bit technical there, but, he's even questioning the drugs. And I didn't put this in the blog, but I began to wonder this. I know that a large part of ablation is working because people finally feel they're getting something done. They feel they have a serious heart condition, and they think they need a serious solution. Heart surgery is definitely a serious solution. But, as this doctor, what's his name, Mendrola says, it may just be an elaborate placebo. And there's a lot more going on as well. The certainly the side effects of the drugs make people feel worse, and they feel, well, look, if I just get this surgery, it'll take away the problem, I can get off the drugs. So that's an incentive to allow the surgery to work. And also, this could be a major part of it too, the stress of having AFib and it not being attended to and treated. People may think that the surgery is going to cure them, and that drops their stress level. I mean, stress is huge in this condition. How many people have told me when their heart starts palpitating, they start panicking and have anxiety and go to the hospital with an anxiety attack, get diagnosed with an anxiety attack, and not, with their the real fibrillation condition. So Mandrola ends up saying, I've ablated AFib many hundreds of times over the past 12 years. I do fewer ablations now. I go slower. Patients and I have long chats. We discuss their symptoms and the reasons for them, et cetera, et cetera. And then he says, could a nurturing, respectful, and optimistic doctor-patient interaction deliver anti-arrhythmic effects? And I end up saying that Dr. Mandrola sounds like he's ready to hear about REMAG for AFib, but I have to admit that I'm not going to be the one to tell him because, back in the early 1990s, my licensing body came after me because I said bad things about sugar, so I'm sure they would send out a firing squad if I tried to tell doctors that magnesium can help treat AFib. Nope. I'm just going to keep telling those who do their research and homework and find out about our work. And then I offered our AFib book for free to people who want to explore the alternative. I mean, it's totally awesome that this doctor is actually giving a good representation of his experience with his surgery. I mean, this doctor, it sounds like he really likes his patients, and they probably come back to him and are able to say to him, look, doc, it's not working. It's just not working. Whereas I know other doctors, if a patient isn't on board totally with their decision to do the cardiac ablation, the doctor will get mad at them and start yelling at them that they're going to die if they don't do something. So this doctor is listening to his patients and realizing that the ablation is not the cure. So I've more to say, Ginny's blog, etc. But Ginny, any input? I hear you've had emails from readers of the blog and customers about this. Have they said anything in particular?
Well, I mean, we did. We got absolutely slammed today with people who read the article, and, of course, they wanted the copy of the book because they have suffered with AFib and have friends and family members that have considered these kind of procedures themselves and want to be, able to pursue a more traditional, I say traditional because, if you're magnesium deficient, you would take magnesium. It just makes so much sense. That's just like if you don't have gas for your car, you put gas in your car. You don't go out and buy a new car or have some part cut out of your car and you still don't have any gas. This is what happens with so many people, and this is what this doctor is realizing. And, of course, many people were also very frustrated saying, ooh, this makes me so mad. And because it's been perpetrated against, so many people. And even if you're not a person who's had to have an ablation surgery or even had that suggested, it's just the idea that, just like what used to happen, years ago with women, just arbitrarily they'd go in and have hysterectomies and, all these other kinds of things, cutting out parts and doing all this crazy stuff. But I do definitely think that the guy has to get a certain amount of props for coming clean. it takes a lot of courage, I think, to have been there, done that, and admit, hey, I'm just seeing the error of this whole thing, and, this is not good. And there are doctors, I see them popping up here and there who are, whether they were in cancer research and now they're finding nutritional-based remedies, or, this guy who's doing this thing over here. I mean, there are doctors who are being affected, I think, by this change in this ascension and these what's happening in the planet. And the pressure of constant failure is forcing them to have to reinvent themselves, right? Would you say that?
Yes, that's a great phrase, the pressure of constant failure. I mean, the doctors have propped themselves up as a profession to be godlike and know everything, and you just can't these days. And that's why a lot of doctors are so against the Internet, because there's so much information out there. A lot of it is half-truths, etc. But doctors can't keep up with it all. They just can't, and they just don't want to be questioned about, well, I read this on the Internet, and it says that and that and this and this, and they just don't have time to read it and decide. So they just get, really patriarchal or matriarchal and put the person down for not listening to them. So it's gotten to be a real battle. And yes, so Dr. Mandrola for coming clean, I think it's fantastic. But then, when I put this in the next edition of the atrial fibrillation book, I am going to say, but some people, I'm sure they have been cured with cardiac ablation. But I will still always say, if you do go for ablation, you have to take your magnesium as well. It's not one or the other, but you start with your magnesium and all the complement formulas, because if it is true that there is stretching and maybe some scarring and irritation from the cells being disrupted, you want your RNA drops to be able to make healthy cells. So that's where the complete package comes in, put it all together. And, that is important to do the whole package, because otherwise you are faced with medications, even after you do cardiac ablation, they still want you to stay on your blood-thinning drugs. So, yes, that was an amazing vindication ceremony here.
Yeah.
Not that I've never told people, oh, you can't get surgery. I'll never do that, because it's not the case, in what is it that Ion says, in every situation. You really have to be individualized in healthcare. And actually, again, that's where HMOs and the whole mechanical healthcare system now, where they try to make everything regimented, everyone does the same thing, that's another reason why it's failing, because that's not the way the human body works. Okay.
Right. I want to just say, too, Carolyn, that I think what you said is so important. You're not saying don't do it. You're just saying you've got to, try the magnesium, prepare your body, and realize as the next thing that we talk about comes up, and this next blog that that I wrote today, magnesium deficiency is the source of so much disease. It's incredible. And it's not just like, oh, I don't feel well and, I can't sleep at night and I think I might be magnesium deficient. No, people, it's much deeper than that. This is really a situation where, and I looked at this book that I wrote about how Mildred Seelig traced from the fetus to the grave what the effects of magnesium deficiency are. And, people have got to have it. They've got to have it, and they should be using it, and they should be using it every day, whether they feel good, bad, or indifferent, because it's absolutely required for the body.
Right, right. Yes, continue on. You should be the one talking about your blog. That's awesome, because I had forgotten about her study. And people, you can get that study, read it freely on mgwater.com, a magnesium research site.
Yes, yep, you can. And like I said, I took a look at it and really went through the whole thing because I was I've been thinking a lot about what we've been talking about off the radio for the last couple of weeks, which is how there are two different kinds of symptoms. It seems like symptoms that might be related to trauma or some kind of a different kind of event, and then there are symptoms that are strictly magnesium deficiency related, and they go away when magnesium becomes present in the body. And, magnesium, and this is what Mildred Seelig wrote in her thesis, Magnesium Deficiency and the Pathogenesis of Disease. And literally, like I said, started with the fetus all the way through to death, and showed where magnesium is imperative at all these different intersections, and not just, and of course, one of them was atrial fibrillation, type 2 diabetes, cardiovascular disease, and every single kind of inflammation. And she also talked about pregnancy in women, which I'm so glad I saw it, because we get a lot of emails from pregnant women. Should I take magnesium? What does Dr. Dean think? And I'll be able to even, point to even more research because, and rightfully so, God bless pregnant women. They're so nervous, and they should be. It's not a problem, about what they put in their body when they're pregnant, and thank God they are, because I think my mother probably ate, drank, smoked, and God only knows what she did when she was pregnant with me back in the 60s, So I think that this article was just, her whole presentation is fantastic, but really to understand that the core of so much disease is really just simply magnesium deficiency, and then, as she points out, the other nutrients that interfere or agents that interfere with its utilization. So, and it affects the structural abnormalities of membrane cells, organs, and entire systems. So, that's a lot.
Right. Yes, I'm just on mgwater.com. I just put in magnesium deficiency and the pathogenesis of disease, and it just goes on. The contents, the list, as Ginny was saying, she talks about ischemic heart disease, heart, skeletal, and kidney diseases, changing magnesium, and she talks about vitamin D here. This is in 1980, people. This is 36 years ago, and she laid it all out. And, I'm sure I've quoted it in the Magnesium Miracle, but she says it all here, talking about pregnancy, eclampsia, whole chapters on it, talking about hyperparathyroidism, on and on. Yes, that's a great reference. And see, this is the type of thing you can print it all up and take it to your doctor and say, look, I want to have intravenous magnesium the next time I'm in the surgery or whatever. I have correspondence with people. There's one PhD who's on dialysis, and she says that she's done experiments where she'll have her blood tested for magnesium before dialysis and after dialysis. After dialysis, she's deficient in magnesium. They've stripped her of magnesium. Every time she has dialysis, she loses magnesium. And the only way she's keeping herself from having high blood pressure, heart palpitations, and leg cramps is by taking Remag. But she's on a mission to try to get them to at least put a little bit of magnesium in their dialysate, what they put into her body every time. So yeah, people are fighting this fight on all levels, and this article, this huge paper, will go a long way to helping you all with your research and backing you up. every time we get a great testimonial, usually the person will say, yes, and I try to tell all my friends and family about my incredible results, but they won't listen. So we just keep plugging on.
That's right. But, and as you said, even if they won't listen, the most important thing is you do it for yourself, first. And speaking of magnesium deficiency testimonials, Carolyn, do you have that one close by?
Yes, I sure do. That was the next words out of my mouth are incredible testimonial. Ginny already put it on Facebook. This woman says, I don't know if we have her age, but she says, thank you for the opportunity to share what REMAG has done for my life. I've recently been diagnosed with a severe magnesium deficiency, which we still don't quite understand, but has left me in horrendous muscle pain for months. The muscle tetany has been a progressive problem over the years, and sadly never properly diagnosed for 10 years because I could not afford to see and follow up with a doctor. And then finally, 2013, after dealing with and attempting to treat naturally my chronic pain, I was able to receive proper medical care. First of all, they thought it was a B12 folate deficiency and began therapy. Now, I mean, this is just a sidebar here. This is what happens in medicine. B12 folate, that's the whole MTHFR methylation situation. So now everybody, it's all about methylation. So that's the first test they do, ignoring the fact that someone has chronic pain, horrendous muscle cramps, and that's magnesium deficiency until proven otherwise. And then she had to go undergo major surgery August 2015 and had not realized that she'd become severely deficient in magnesium. The muscle pain became so intense that even strong narcotics were bringing only limited relief. And finally, her doctor gave her an IV infusion of magnesium, and boom, I had immediate relief. We finally decided to do an extensive blood panel, and yes, she was deficient in magnesium. She was not absorbing magnesium on a cellular level, but then she began to take magnesium citrate powder, would get some relief, but it was short-lived. And it was back and forth adjusting whether she'd go into severe diarrhea or swing to the opposite end and have constipation. So, that's the problem with many people who need high levels of magnesium, therapeutic levels. They just can't get enough before they get the laxative effect. I went back for several more infusions, she says, but then had another extremely stressful event and just couldn't seem to maintain. My doctor read about REMAG and asked if I would be willing to try it, and within the first several minutes of taking REMAG, I felt like I did at the start of my first infusion. The magnesium citrate never gave me that kind of relief. She puts never in caps. I worked up to a total of 900 milligrams the first several days. That's 3 teaspoons. And then went back down to 600 milligrams, and I'm feeling in caps again, so much better, exclamations. All the neuropathy and tetany have severely diminished, and I've never, since that began 10 years ago, had this much consistent relief. I'm just blown away how truly life-changing this has been. I'm finally experiencing constant freedom from the intense pain. I do still have some, but nowhere near what I had. I think I probably emailed her, or we should, Jimmy, and say, make sure you're doing your Himalayan or sea salt in your drinking water, get on your Remite as well, and that it's going to take, take a year to really get her magnesium stores up. So, she's going to continue to feel better and better. So she thanks us for all our hard work and the the incredible changes it's made in her. So yeah, that was huge. She said it all there. 10 years of pain, tried other magnesiums, the Remag within the first few minutes had the same effect as an IV magnesium, and what we're saying is why go to the expense of IV magnesium, which you'd have to do every day of your life in order to keep the levels up. Why do that when you can do sip your Remag every day? So yeah, that was one of our awesome testimonials. Anything to add to that? Because I do have two more things before we turn it over to the phones, etc., Ginny.
No, press on.
Right. It's about restless leg syndrome. Someone said, I have a friend who has suffered restless leg syndrome for 40-plus years, and I guess it's a he, also has insomnia. Yes, he's seen many doctors, been given one prescription after another. Now they just give him methadone. Gosh, methadone they use to get people off heroin. Please talk about this issue and your recommendations so I can pass this on. Thank you for all your research. Magnesium just makes sense. I really see the connection. I wish I'd heard about this years ago. So with restless leg syndrome, I have blogged about it. Like I say to people, just Google the condition and my name and something will come up. And I do remember when I wrote about it years ago, and I said, it's kind of a made-up disease in a lot of cases because, a lot of people have twitchiness and everything, and it's a magnesium deficiency. Instead, they place it with drugs on it. And I offended at least one person who says that he or she really has this problem. They've tried everything, and how can I act like it doesn't exist, that it's just creating the disease and offering the cure. But I modified my blogs, but it looks like I've written several of them. I just typed in restless legs, 1, 2, 3, 4, 5, 6, 7. a lot of blogs on restless legs, and the bottom line is that a lot of people get restless legs when they're on medications, and it's either a side effect of the medication directly, the toxins of the drug, or the drug is causing magnesium deficiency and causing your legs and nerves to be irritable and irritated and restless. And what I say to people is, look, just try Remag. You will know if it's going to help. There are some people where there could be an emotional component. Their legs are restless. They want to run away from an untenable situation. That would be a total biology remark. You're in a situation, you can't get out of it, you have to stay, but your legs know they want to move. And the other minerals, potassium can be affected in restless legs, or deficient, I should say. And for that, you make your potassium broth. And that recipe is in my Remite book, Invisible Minerals Part 2 book. And can be iron deficiency in some people. So for that, make sure you get an angstrom iron, the iron that you're prescribed or even over the counter is only a few percent absorbed, and the rest will cause constipation. So take high animal products, protein, meat, rare steaks, get your iron from that or from blackstrap molasses, and prove it to yourself whether or not iron is a problem. So it's iron, potassium, but mostly magnesium. So that's what I would say about restless legs. And, if someone's had one prescription after another, it really is just going to worsen things over time. And there may be a level of toxicity that a person has to work out, which would be our Realign product, and also our RNA drops to help gain a little bit of detachment from the condition. Okay, so that's restless leg syndrome. And a general question came through. This is obviously someone who's not read the REMAG book, but every once in a while it's good to just give a general answer. Please explain how we keep our magnesium, potassium, calcium in balance when taking REMAG. So you do that by making sure you're doing your sea salt or Himalayan salt in your drinking water for your sodium and your trace minerals. You do a lot of vegetables, which is your potassium. You take your calcium from your diet. You go to the calcium food list in the REMITE book and make sure you're getting 600 milligrams of calcium a day. If not, then you go to an angstrom calcium or keep on the long march, the long wait for recalcia, which we're still waiting on for your 300 milligrams per teaspoon from the recalcia to get a properly ionized calcium that's well absorbed. And you take your REMAG and you take it in therapeutic amounts, and when you don't need as much REMAG, you will get the laxative effect, and there's your balance. And the next part of the person's question is REMAG as safe as taking regular magnesium? Nutrients, kind of in the drug-based way. The RDA is very much out of date. It's half as much as we need, and the calcium is twice as much as we need. So the RDA 300-400, I'm saying you need 600-800 milligrams. Some people need 900-1200 milligrams therapeutically. And it's even safer than magnesium supplements. If you look at the magnesium oxide, Flomags, the different prescription magnesiums, they have all kinds of additives in them. REMAG is just your magnesium chloride in a process where the ions of magnesium are stabilized so they can be absorbed cellularly. So that's the general question answered, and I'll turn it over to you now, Ginny, so we can use the last 15 minutes wisely.
Very good. Last 15 minutes of this first hour. Okay, let's just take some phone calls if we have callers who would like to talk with Dr. Dean, and we do. 602-666-6027 is the phone number. 602-666-6027. And what you do is you hit star 5 on your keypad. Star 5 will raise your hand and let me know in the studio that you want to talk to Dr. Dean, and then we will put you on the line with her. And in the absence of callers, then we go to our mailbag. But, of course, we always have people who want to talk to Dr. Dean because she's charming and elegant and full of wisdom and light. And that's usually what people experience when they talk to her. So let's go to New Jersey. Carolyn, if you want to take a few phone calls. And
sure.
Then we'll proceed with mailbag. All right. So area code 856, the great state of New Jersey. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment. Hello. Hello, New Jersey person. Are you there?
I had myself muted.
Okay, there you go.
Okay. Dr. Dean?
Yes.
Okay. This is going to sound like a dumb question after I sit there and listen to what you had to say, but I've had a bad back since 1989. I've had back surgery. The pain comes and goes in different levels of from mild to severe. I started taking the REMAG I guess 3 or 4 months ago, and I got the laxative effect, so I quit, and I went back to magnesium citrate. That's what I had been taking previously, but then I have started back up, and I think I called in when I started taking it. I was taking way too much, and now now I'm taking a smaller dose, and suddenly my back is starting to feel better. And I was just sitting here reading while I was waiting some of the things, nutrition for spine health. And of course they say calcium for your vertebrae, but then they throw in magnesium to, the calcium won't work without the magnesium. So and then they talk about the tendons and ligaments, also, and the muscles all cause pain. So, like I said, it probably sounds stupid now, but have you done any research as far as magnesium affecting the nerves coming out of the spinal column?
Well, I mean, I don't have to do the research. This isn't Kyle, is it?
Yeah, this is Kyle.
Yeah, I recognize your voice, Kyle. Well, I personally don't have to do the research. We just kind of gathered the testimonials where people say they have, chronic nerve pain, numbness, irritation, all that. They take magnesium and it goes away. And then when you read the research papers, like the woman, the doctor, Ginny was quoting Mildred Zelig. She wrote back in 1980s, and she lists all the research papers about how they, have people with injured muscles or nerves, and they give them magnesium, and there would be improvement. So we know it works. It's just getting it the right amount in the right way, and you kind of proved it in a sense because, you were taking too much and you flushed it out, and that's why we say, figure out a daily amount, and the therapeutic daily amount for people with severe problems is 2, 3, and sometimes even 4 teaspoons of Remag. Put it in a liter of water, sip it through the day so that you're always giving yourself a constant amount. If you take 1 or 2 teaspoons all in one whack, you're going to overload your cells, and it's going to flush out. So that's only...
Yeah, that's what I did. I was taking teaspoons in a bottle of water.
Right. So if you sip it through the day, or like you say, you cut back, then you get it in your body. See, when you get that flush reaction, you're actually pulling out, almost as much magnesium as you're putting in with the diarrhea. So, you haven't even treated yourself at all. So it's a great lesson. I'm glad you called in, Kyle, and brought it up, because it is about the right magnesium, because the Remag is what gets into the cells. The magnesium citrate, it's good for some people to start off. I tell people if you're constipated, take the magnesium citrate along with Remag, because the Remag is what jumps right into the cells, gets all the enzyme processes working, heals up the nerves, heals up the muscles. So, yeah, you're just at the beginning now of healing this back problem.
Right, and what's so amazing is I just started like a couple of weeks ago, and I had to work double shifts, which normally, just knocked me out. I really get in pain, and both times I had no pain after doing that, and I'm like, what is going on here? So now I've got one more question, because I'm convinced of Remag, so I'm ready to go on to another product now. So let me tell you all the other vitamins I take, and then you tell me what I can replace them with from the complement formulas. Okay?
Okay, yeah, this will be fun.
Yeah, this you'll think I'm crazy probably. I take the vitamin C, vitamin E. I take then I go to krill oil and xanthan for my omegas, and then I get on resveratrol and Aca for antioxidants, also grape seed extract, Also, coenzyme Q. These are all like antioxidant things. And now I'm on a diet supplement that has green tea extract and the digestive enzymes and probiotics. Now, what can I replace with one of your products?
Well, the vitamin C, I'm telling people to go for a food-based one or make their own liposomal C, but also with our Restructure protein powder we've got coming out, we've got it's 60 milligrams of food-based vitamin C from acerola. So, when you get the Restructure, that will take care of your vitamin C, as well as eating a couple pieces of fruit a day. Vitamin E, we don't cover that, but if you use vitamin E, make sure it's a complex vitamin E. There are 8 or 12 different components of vitamin E, so make sure it's a vitamin E complex. And, vitamin E is hard to find in the diet. It's good for the heart, etc. The others, the krill, as I can't even pronounce the xanthian. Xanthian.
Yeah. Which is supposed to be the creme de la creme of all antioxidants. It's supposed to be the most powerful one.
Well, it's not. Magnesium is. And what I'm going to say is that one, the resveratrol, grapeseed, even the CoQ10, if you still had back pain when you were taking those, they weren't helping to defeat the inflammation causing your back pain.
Right. I forgot to ask you, but from reading this page, that was one of the things it said. One of the biggest problems with back pain is inflammation.
Right.
So
that's what I say to people. If you've been spending all that money for those products and you were still in pain, then they weren't working. I mean, a lot of people do take these products because there's a lot of, there's a lot of hype about them, a lot of marketing. But then if you take them for more than 3 months and they haven't changed you, like you say, the Remags, made some changes in just a couple weeks, then it's really not doing much for you. The krill oil, I'm not keen on krill oil because I know it's whale food, and I don't like the thought of us harvesting the ocean for whale food. I mean, that's just sort of a personal thing I've got. But what I do for the essential fats is I get people to look at Blue Ice Royal, which is a fermented cod liver oil, and butter oil. And together they provide you with vitamin A, vitamin D, and vitamin K2. And essential fatty acids. And in our Restructure, it also has marine algae oils and flaxseed oil. So that's going to be your essential fatty acids taken care of. Green tea, digestive enzymes, probiotics. Well, green tea, I think that works because it's caffeinated, so it just speeds people up. Digestive enzymes, I only like them if they have hydrochloric acid in them as well as some pancreatic enzymes, because it's usually a deficiency in hydrochloric acid that keeps a person from digesting their proteins. Probiotics, I'm really keen on Prescript Assist. And actually my list of, like I've said to you, what I recommend, it's in a blog, Kyle, that's called Dr. Dean's Supplement Recommendations, and I throw in our Realign that has the methylated Bs and the precursors to glutathione, which is actually, along with magnesium, the body's super antioxidant. So instead of using external antioxidants, I tell people, well, let's boost your own glutathione and take magnesium, and that usually takes care of all the inflammation.
Ah, wow. I never understood that. All the times I've listened to you just talk. I didn't understand that's the way magnesium worked.
Right. Well, that's why, it's good you called in. And see, once it starts working for you, then you're able to say, it's working for me. Maybe it's because of this. Until it becomes personal, it's often, difficult to really understand all this stuff. We're up at the top of the hour, Kyle. Do you have any more questions, or are we good?
No. But so the one you would say to try first would be restructure?
Well, the realign and restructure. Restructure is going to be out in less than a month for sure. That's our whey protein powder, and that's got a lot of nutrients. We'll have the booklet out to you pretty shortly so you can read up on it, okay?
Okay, and the realign does what? What is that?
It's got the methylated B vitamin.
Oh, okay. Yeah, I take B12 also. Yeah. Okay.
Yeah, there you go. Okay.
If this cures my back, that's probably, other than hearts, that's probably the single biggest problem in the world is a back problem.
Yeah, you're right, Kyle. Okay, thanks a lot. Bye bye.
Okay. Goodbye.
Excellent. Great call, Carolyn. Very nice, Kyle. Nicely executed. We're going to hear at the top of the hour. We'll be back in just 30 seconds with more Dr. Carolyn Dean. All right, everybody, hang in there.
Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Describe the words you know regarding amino acids and our process of ascension. We are trying to get to the marriage supper of the Lamb.
What happens in the blood is you require protein carriers for different things through the blood.
Protein carriers in the blood segue through basically the essence of lysine to change the way that the molecules or the specific gravity, how blood is. If you change its molecular specific gravity, you change how it flows. It's the blood that gives you strength from day to day, and it will never lose its power. The methylation, but it changes the specific, the outcome of the methylation changes the specific gravity of blood. When you start spinning out patients who have been ingesting RNA drops, the specific gravity of their blood will change.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
We return now live with Dr. Carolyn Dean, along with your host, Ginny Gunther, here on AchieveRadio.com. Skype us at ar.call.in. That's ar.call.in.
Welcome back, everybody. Hour 2 of Live with Dr. Carolyn Dean here on Achieve Radio this evening. So happy to have you with us, and even some of our wonderful long-term listeners like our good friend Deborah in North Carolina. Carolyn, who's tuned in this evening, want to give her a love shout and just say hello to Deborah. And also, of course, Rami's here, so happy to have her hanging out with us. I've got a couple questions on the chat line, Carolyn, about magnesium testing. Maybe we could go over that real quick and then go back and see if we've got any phone callers that might want to chitty-chat with you.
Okay, sure.
Okay. So Kim typed in and she said, please explain energy systems that magnesium supports. I just did my magnesium RBC test and mine is 6.5. But I've been exhausted and fatigued for many years. I started using the Remag with some trace minerals and water, and I noticed an improvement and my fatigue decreasing. I'm assuming it's because of the way I was formerly taking a different brand of magnesium. So then I just asked her, did she stop taking the magnesium, the Remag, before the test? And she said no. She had taken it the night before. So I kind of thought that might have skewed her results a little bit.
Yeah. Yeah, sure.
She says she's feeling improved, and especially in arthritis in her back. And but I was hoping you could talk a little bit about magnesium testing. And then we had another question come in, and maybe we can make this a double hitter, where she asked, she wants to know if she says she has a lot of low magnesium symptoms, and but she's wondering, can her menopause hormones affect a magnesium RBC test? She takes progesterone and was wearing an estrogen patch the day of the test.
No, the estrogen and progesterone will not interfere with the testing. I wouldn't think that would be possible. But, okay, here's what I wrote in my 2000 edition of Magnesium Miracle, because we do get a lot of questions about the magnesium RBC test, and people will say, it's 6 or it's 5.8, and I still don't feel well, or it's still 4, and I've been taking Remag for 4, 5, 6 months. Why isn't it higher? And the problem is that the magnesium red blood cell test is not 100% accurate in terms of the magnesium ions in the blood that are going to jump into your cells and do their work. In fact, this might get a little complicated, but you're asking, red blood cells do not have mitochondria. So they don't have the little energy machines in them like all the other cells do that attract the magnesium and then run the magnesium around in 6 of the 8 steps of the Krebs cycle. So if they don't have thousands of mitochondria in them with, hundreds of thousands of molecules of magnesium, you're not going to get that much magnesium in a red blood cell to give you an indication of the ions of magnesium in our cells. The test that will tell you about your ionized magnesium levels is the ionized magnesium test, and it's still not available to the public. It's still just in the research stages. They still haven't worked the bugs out of it. In the 2017 edition, I talk about a review article that talks a lot about we've really got to get this ionized magnesium test down pat. We've got to make it available to the public. We haven't got a clue what's going on with magnesium in the population because we don't have a test for it. And this is, we're not even talking here about the serum magnesium test, which is close to useless. So to put all your eggs in the basket of magnesium RBC is inappropriate. I've tried to make that clear, without outright saying don't even bother to get any testing because you're going to get confused. I mean, I had one doctor actually telling me, well, I don't think your Remag is working because I took it and then my red blood cell test was lower the next time I took the test. And, the biochemistry of that is very simple. When you've been magnesium deficient for so long that As soon as you start taking the Remag, it just slurps it all up and utilizes it, and it starts revving up your 700-800 enzyme processes. It'll use more magnesium than you've ever used before and use it up, and your levels can be low. So, there's this huge interpretation that has to go on when you're using a test that's not a perfect test. So, if there's any feedback on that, let me know. And like Ginny said, you really have to stop magnesium at least 12 hours before. I mean, I've heard some people say a day or a week before, but I'm not going to get people to do that just for, scientific purposes, because you're going to feel horrible if you stop your magnesium for a week if you're in the middle of therapy. So you just have to really realize that the test is somewhat of an indication of your magnesium levels, and over time they'll go up. But in the first 3-4 months, they could actually go down. Ginny, over to you.
Excellent. Very good. Thank you, Carolyn. Live with Dr. Carolyn Dean here on Achieve Radio, Hour 2 of our program, where we go over our mailbag and take customer questions from our callers. If you'd like to talk with Dr. Dean tonight, 602-666-6027 is the number to call. That's 602-666-6027. You have to raise *5. Raise your hand by hitting *5. My mouth is not working tonight. *5 on your keypad, and then I can see your hand in the studio, and I'll put you on the line with Dr. Dean. Otherwise, your phone remains muted, and she won't be able to hear you. So *5 for sure. And if we don't have any callers who have an immediate interest, and I see so many of our regular listeners on the phone, Carolyn, I think what we should do is go to our mailbag, because I think we've got a lot of questions this week.
Yes, and I have a lot of information to put out as well. This one is about floaters, eye floaters. Last week we talked about that, and someone gave me some information from their experience about oxalates in foods. Oxalic acid is in a lot of vegetables, for example. And this woman is saying, I just listened to last night's show archive, interested to hear your response about eye floaters. I had floaters and flashers for 8 years or so, beginning with when I was in my mid to late 50s. In 2012, I started a low oxalate diet in eager pursuit of the relief of vulvodynia, that's painful vulva, interstitial cystitis, and urethral syndrome. I stopped eating spinach, chocolate, nuts, yams, beans, and many other foods high in oxalates. At some point in 2013, the floaters and flashers disappeared, which I was certainly not expecting. My ophthalmologist confirmed that my eyes were better, whatever that meant, and continues to be the only physician I've ever encountered who became receptive and interested in the effects of oxalates in the body. Since joining a low oxalate support group, I've also read several testimonials regarding this interesting phenomenon. I'm not the only one who has experienced the cessation of eye floaters after reducing oxalates. She is using Remag, Remite, Reline, and the drops since October of last year. So for 9 months, I'm very grateful to have found me and mine, she says, you and yours, and your hopeful, life-changing information. Continue to study, learn, listen daily. Look forward to the time when someone asks me how I do it so I can happily reveal all. Okay, so I appreciated this. I said I'd probably talk about it on the show. And I'm not telling everybody with eye floaters to stop oxalates, but it can be helpful in the transition. Here's what I think might be happening. Oxalates, they're food. They're in our food, and gosh, the one she mentioned, I'd hate to have to give up my cacao and spinach and nuts, and I don't really have yams, but I do have beans. And what I realized is that oxalates are in our foods. They're in alkaline foods. They're in bitter foods. We need the bitters as part of our dietary balance. And what I think happens is when you read that oxalates strongly bind to minerals and vice versa, and then they reduce your absorption of your minerals, well, maybe that's in people who have very low minerals to start with. It's like you really notice it then when you're eating a lot of oxalates and it binds more of your minerals because you're already deficient. So what I'm wondering is if this person, as she says, she's on the completement formulas, and I don't know if she has to be as strict as she did. Yeah, she says it's like an adjunct to what she's doing. But I'm wondering if you have enough Remag, Remite, sea salted water, if then you can have your oxalates and not be so worried about them reducing your minerals, because you're taking a little more minerals than they are taking away. It's like you give up some of your minerals to your oxalates so you can have the other good things that those foods provide, so that you don't have to become a strict food avoider, having to be so paranoid about your food. So that's my thinking about it, and I don't know if that's true, and I'll continue to research what magnesium and oxalates have to do with one another. If having magnesium helps your body disperse the oxalates is quite possible, because I'm sure there are a lot of people with pain conditions and irritated body parts who are affected by high oxalic acid, but when they're doing their hydration and sea salt and Remag and Remite, then the body deals with these things. It's like, why all of a sudden are we not able to eat common foods? Why are the oxalates suddenly the enemy? And if it's because we're so low on our minerals that they just throw things more out of balance, then just, take more minerals. And also, maybe eat a little less oxalates while you're working through these, serious conditions like interstitial cystitis and urethral syndrome and even eye floaters. So, Carolyn, what do you think of that?
Somebody typed in on the chat line, Carolyn, and said, hi, guys, I have eye floaters, too, and was told they are spirochetes from Lyme disease. Could this be true?
Spirochetes. Close.
Spirochetes.
I don't know. I mean, I really don't. I don't know. I couldn't comment on that. The spirochetes are these, really vicious organisms responsible for Lyme disease and syphilis. There's syphilis organisms. So, I mean, that's getting probably a little too complicated.
Right.
Yeah.
Right, yeah, right, understood. Yeah, absolutely. And, okay, very good. Okay, very good. Keep going. Sorry.
Okay, so that is floaters and oxalic acid. So I'm ready to move on to the next mailbag if you are.
Sorry, I was already so ready I put you on mute.
No, you're that ready. Okay, this is from a while back, and it's just to mention that a person wrote in who says she works with Paul Pitchford, who wrote Healing with Whole Foods. He has researched everything. I take all my questions and food and supplements to Paul. Usually for supplements, he says no. and he doesn't believe for the most part in supplements, just specific ones. I asked him about Remag and Remite, and he told me to go ahead, as both seem to be really good products, the ultimate endorsement for me. Now, what she doesn't seem to know is I know Paul, and he wrote a blurb for my Magnesium Miracle article, book, and that was back when he was starting to realize the foods were deficient in magnesium. So that was nice. Mike Adams a few weeks ago wrote a post or an article in his Natural News website, and the article title is Neuroscience Journal Confirms Adverse Effects of Fluoride on Brain Development. So I know, Mike does often come across as a bad news bear, but, he does bring information to the table all the time. And yes, fluoride is not good for us. There's fluoride in our water and dental products, in most toothpaste, and in a lot of drugs. So it is best to avoid fluoride. But if you have to take fluoride, take a lot of magnesium along with it to bind up the fluoride. And it doesn't really even leave the body. It can deposit in the body. So it's best just to avoid fluoride altogether. Now, I have a lot of really long mailbag ones, but let me go to topic. It's about hyperthyroidism, and we do get questions about this periodically, and I finally gave a nice FAQ for customer service, and I'll read it out to you. This person says, I've been reading up on your products. There's a lot of discussion about how they can help balance the thyroid hormones, particularly hypothyroid, but no mention of hyperthyroid. She says, I have multinodular, non-toxic goiter, and it is usually stable, but I do tend to be on the hyperthyroid side of things and can tend to feel a bit speedy when I'm really stressed. But I do have times of lethargy and tiredness. I'm wondering if these products, A, would be useful for me being hyper rather than hypothyroid, and I don't know if there's a B there. So the answer is hyperthyroidism is an autoimmune disease where the body is attacking thyroid tissue, causing inflammation, and often creating thyroid antibodies, which make it a diagnosis of Hashimoto's thyroiditis. Most Hashimoto's is diagnosed after the inflammatory stage when the thyroid is burnt out and hypothyroid. My theory on the most common cause of autoimmune thyroiditis is yeast overgrowth. Many of the 178 yeast antibodies produced by yeast can block hormone receptors, including the thyroid, and cause thyroid tissue damage. Thus, yeast treatment should be part of the hyperthyroid protocol. Yeast can flare and recede and can account for the hyper teeter-totter effect that some people have with their thyroid imbalance. One of the causes of hyperthyroidism is taking too much iodine. So most doctors caution against taking any iodine if you have hyperthyroidism. However, the reason iodine can be a problem is because it begins a cascade of compounds that lead to thyroid hormone production. The cascade gets jammed up and problematic if there is not enough selenium and the other 7 minerals required to make thyroid hormone. Remag helps treat the inflammatory aspect of hyperthyroidism, and Remite can help unblock the cascade and help heal the thyroid by providing the thyroid with minerals it may be missing. Remite does have the very low RDF iodine, so if people with hyperthyroidism try it, they should do it very slowly, starting with 10 drops a day and slowly working up. 1/4 teaspoon is equal to 30 drops. So I want to ask Ginny if she's had any feedback on that FAQ for hyperthyroidism.
We did, it was one of the gals did respond and said that she actually felt that she was suffering from yeast overgrowth, and she had what was it, thrush, I think, for many different times. Yep.
Yeah.
But then I went on and responded, and so she said thank you, and then I responded back and said, well, what are you doing to treat the yeast? And she's like, low carb, low sugar diet. I'm like, uh-oh. So then I sent her the rest of the information. So, yes, I think it is hitting home with people who are getting that response from us.
Good. Okay, that's great. And then hot on the heels of me doing that, I got a question from someone where might have their AFib and wondering about the iodine there. So let's look at this. This woman gives, I think she mentioned the problem first and then came back with her history, more thorough history. 69 years old, and this is interesting. It's like the total body meltdown picture. At age 13, church camp, swam in a cow pond, terrible sore throat, high fever for 3 weeks, shot of penicillin didn't work, blood test had a weird strain of streptococcus, a new kind of antibiotic, and my heart was never quite the same after that. Even so, she was still very athletic. So that's the start there. Shot of penicillin, new antibiotic. I don't know if it would have been a fluoride drug that far back. But with antibiotics, we do think about yeast overgrowth right away. Age 19, diagnosed with a goiter. So they started me on thyroid. That would be probably the synthetic Synthroid. They said it would keep the goiter from growing. Had 2 children. Age 22, teaching school, got 3 staph infections in a row. One at the entrance to my nose, one on my cheek, the other on my thigh. Now, staph infections occur usually in the environment of yeast overgrowth. So this is a yeasty person. The doctor had me come in every day and insert a new gauze wick. Then I'd soak the infected area with Epsom salts every hour. Okay, at the end of something or other, I took a month of antibiotics. So there's your yeast overgrowth even more. Age 38, 30 to 40, played on a women's softball team, gave it my all, bought a new house, put in a yard, overdid it. And that's what started my fibromyalgia that I have to this day. Now, fibromyalgia is magnesium deficiency and yeast overgrowth. So, with all that sweating from the softball, working in the yard, so she's sweating out her magnesium, getting fibromyalgia. Diagnosed in 1992. My chest hurt so bad I had to lie on my back in bed and hold the blankets up with my hands so that they would not put pressure on my chest. Oh, boy. All kinds of tests. Rheumatologists decided it was fibromyalgia and mitral valve prolapse. Mitral valve prolapse is magnesium deficiency most often because the mitral valve has 2 valves that kind of like point together like the church steeple. And if you have magnesium deficiency, they don't flap together completely. They kind of flop and allow regurgitation. And usually magnesium can put that back in balance. So she said with the heart, mitral valve, she'd feel like she was having a heart attack, go to emergency, do an EKG, say she was fine. So they began putting her on drugs. Amitriptyline, they put her on amitriptyline. That's an antidepressant. Of course, it's all in her head. And then she heard on, somehow she found out about magnesium. It might have been just in a health food store. She took magnesium citrate, calcium, and potassium. In 2 weeks, I felt my chest was healing, helped with constipation. And then she goes into details about tried magnesium oxide. 2004 back surgery for an injury from a fall. So, here she is with all these symptoms already, fibromyalgia, mitral valve prolapse, back surgery. Now, she doesn't go into the details, but, she had back surgery from an injury from a fall I had that kept deteriorating and caused terrible pain. Surgeon removed L1, L2 disc, and she said she improved. Oh, good. But lots of issues with my bones, had several MRIs. They say I have stenosis, bulging discs, and bone spurs in my neck. Now, this can all be from magnesium deficiency, inflammation from yeast overgrowth, calcium depositing in the wrong places because it doesn't have enough magnesium, so on and on. Found out I need a knee replacement from a degenerated knee meniscus. 2013 total hysterectomy, pelvic organ prolapse, and total body meltdown. It's just in everybody's history I see so many similar things. The night after surgery for a pelvic prolapse, the nurse found I'd gone into AFib. Had an ultrasound, they decided to have an enlarged lower left area. Wore a monitor after getting home. No more AFib, just irregular heartbeats. 2 years ago, ended up a night in the hospital with AFib once more. Nuclear stress test. Tried 5 different heart medications for about 3 days each, and it made my blood pressure go so low I stopped each one. Now she goes to a naturopath. And, just like I said earlier, naturopath tested her and said I have a MTHFR mutated gene. And, yes, we all may have, but what triggers it, what sets it off is a lack of magnesium. So, the buzzword now is MTHFR. Oh, okay, everybody's got MTHFR, but then, they don't really know how to treat it because they're not looking at magnesium. Then she did thyroid tests, came back, antibody levels were up around 8,000. That's pretty high. So she was put on a whole bunch of supplements, and she still didn't do well. She ached all over with their methyl Bs, and then she found magnesium oil, and she found that helped. Then she came across our information on REMAG. So she started on Himalayan salt and the Realign. And the Realign with our methylated Bs, she said there was no aching, no pain with it like there was with Methylguard. So she was really excited that she could take the Realign methylated Bs. Started the REMAG and was feeling great. And then added the Remite, and her heart started palpitating. Did it for 2 days, and blood pressure was out of whack a bit, but it went a bit low. The pulse was up. So she said she took the Remag down to 3/4 teaspoons, still using the salt, so wonders how to proceed. She's going for a knee replacement in October. So I said, it's good to hear the Realign with the methylated Bs works for you. And I said, since you're not taking the Remite, don't back down too much off your Remag. 3/4 of a teaspoon is not therapeutic. You need 2 to 3 teaspoons. And then I told her the iodine and Remite or the other minerals could have revved up your metabolism. It doesn't mean you don't need these minerals. So what I would do is have my thyroid hormones checked to see if they are high. And if not, I would start taking Remite much more slowly, starting with 10 drops a day and working up. So I don't know if that was boring or if that helped people, that information, but this is what we deal with. I deal with and customer service deals with every day is people with these layers and layers and layers of problems. And then when we come to answering, it's basically take the the hydration guidelines. Take your sea salt, do your realign, and then get into your remag. And each step you do for a few days to know how your body's handling it. And she found out when she did the remide it was too much. And it's not that it's bad for her, it's just she has to take it much more slowly so that she doesn't rev things up. Because it sounds like she did have the thyroid testing and had the high antibodies, so her thyroid's just on the edge, and she really needs to yeast detox in order to stop the attack on her thyroid. So, Ginny, say something so I can take a drink of water.
Of course. No, I think that's perfect what you said, and it is right that and everything that you share, I do think benefits other people, because the one thing that consistently they can understand is that you've got to work with the formulas and your own body, pay attention, adjust, report in, check in, keep going, and evaluate how you're doing. But eventually what's going to happen is that you are going to reach a threshold where you'll flip over into more knowing that you're great and less having to check in, and then you'll just continue to proceed, and it'll be less taxing. It's just in that first usually 60 to 90 days. Now, we have a question on a different topic, Carolyn, that's on the chat board, and that is that Ange down in Mexico would like to know, can you please talk a little bit about leaky gut syndrome and what you should do to go about fixing it?
Right. Yes, because of our debacle with our yeast detox products, we just thought we'd use products that I've been recommending for ages, but that did not go smoothly at all. So I've really begun to look at creating a formulation to balance the gut, because it's what I've been doing before this is detoxing and killing the yeast and trying to come at it that way. But I think it's more to balance it. Till I have that formula, I'm still going to advise the yeast detox, and that does help treat a leaky gut, because in my experience, a leaky gut is very often yeast overgrowth. And the way it's talked about now, yeast is avoided. They just don't talk about yeast. Whereas if you look at the Dr. Crook's yeast questionnaire that you can find on our archives, you'll see that many of the symptoms people have these days is from yeast. And the story I just went over, the history of a person getting penicillin shots, antibiotics, surgery, stress, all that's yeast overgrowth. And that does have to be addressed. So it's a yeast-free diet, avoiding sugar, gluten, and dairy. It's taking a probiotic. The one I most recommend is Prescript Assist. It's eating antifungal foods like garlic and onions and leeks, etc. And there is a yeast detox that we recommend, bentonite, psyllium seed, and castor oil. All that information is on our archives. You just type in yeast overgrowth and it'll come up. So the leaky gut is really, you treat the yeast, you give a probiotic. I know there are other things that people recommend, and I'm working with certain amino acids in the new formula, and it is about reaching a balance. I don't know if I can say much more than that, because if people follow the yeast detox, that's going to take a while itself. So that's where you start out, Ange.
Excellent response, Carolyn. Excellent. Thank you.
Mm-hmm. And more chats, or will I go back to mailbag?
Let's see. Let's open up the phones again. Well, they're still open, 602-666-6027 And if you're on the line to talk to Dr. Dean, *5 on your keypad will raise your hand in the studio and let me know you have a question or comment. And we'll wait to see if anybody's raising their hand or everybody's just kind of lulled into your beautiful melodic voice. We have a couple questions from the chat line. Let me just run over there, too. Let's see. This is from Sam. Dr. Dean, can you please elaborate on the use of vitamin K2 as well as the other complementary components? Oh, dear. Well, this is a lot, Sam, here, my friend. Okay, so elaborate on K2 and then the other complementary components such as magnesium, calcium, vitamin D, and even boron, and how they interact and support each other. Wow.
Well, he's asking about, the bone health nutrients, and you can go to the Remite book, and, we have boron in there. I'm going to be updating the Remag book and make it the Remite book and make it a Remite Recalcia book and go into the whole calcium, boron, vitamin K2 issues. Vitamin K2, vitamin A, and vitamin D, I cover those in the Blue Ice Royal that I recommend. The magnesium and calcium I cover in the Remite book, where calcium you get it in your diet, not from supplements, but magnesium you have to get from supplements. So it's, I think that's enough said now. It's all in writing, and you can Google any of those factors and my name and find articles where I've spoken about them. So I think it's best.
Very good.
Yeah, to do it that way. There's too much information to I could take a half hour, whereas I've already written it all out.
Very good. Excellent. Kim also wants to know, Carolyn, has Dr. Dean ever heard of calcification, such as the bone spurs being dissolved after using magnesium over time so the joint can function without pain?
Yeah, well, we're getting reports on that all the time. I think the one that I've talked about most is the very serious carotid artery calcification, where a gentleman talked about his wife who had open heart surgery 2.5 years ago, due mostly to hypertension and obstruction of her coronary arteries. After being on Remite for several months, her blood pressure had dropped from 180/95 to 110/60. Also, her ejection fraction improved to 60%, which is normal. And her last ultrasound of her carotid arteries showed a 30 to 40% lessening of calcified occlusions. Bone spurs, etc., we're waiting on people who do before and after x-rays for us and show us those results. And calcification is huge. Last week I talked about, we know about coronary artery calcification, heart attacks, and carotid artery calcification and strokes. But the reason why we have an epidemic of kidney disease and kidney failure is because of renal artery calcification. And nobody's talking about that because you can't put a stent in a kidney artery. I mean, that's like major abdominal surgery. So the only way they deal with calcification right now in medicine is by putting stents in. And I'm hearing people having 15, 17 stents, just drilling these metal, I think they're metal. I know the cardiac, technologist, Mandrola, that I talked about at the outset. Yeah, Mandrola. You can look him up, John Mandrola, in his blog. He's blogging about a dissolvable stent, which makes a lot of sense. I mean, stent is another thing that they have not been doing that long. They're just forcing their way through this calcification to try to open up the artery. And apparently they're metal. They've been putting antibiotics, layering them with antibiotics. People may not even know that. and now they're looking for dissolvable ones, whereas, what you want to do is saturate yourself with magnesium so that you can dissolve these things. Now, in terms of bone spurs and local things that you can get to, even breast tissue calcification, which is often mistaken for breast cancer, and it's not, spray it on. Get the Remag, spray it on the bone spur area, let it dry, spray again, do that 4 or 5 times, layering on the Remag, put a sock over your foot to protect the Remag and protect your floor and furniture, and just give us a report. Do your homework on it and give us a report on the effects.
Very good. Excellent. Okay, Carolyn, we've got some phone calls that have come in, and so let's take a few phone calls. And how do you feel about that? Yep.
Sure, yeah. They
Okay,
always rush in at the last minute.
Yes, they do. So we're going to Medicine Hat, Alberta. You're on the line with Dr. Carolyn Dean. If you could give us your name and then your question or comment.
Hello, ladies. This is Louisa.
Hi, Louisa. Hello.
Hi. I was wanting to ask you, I have 2 short questions. I started profuse sweating at night, like with night sweats, to the point where I get soaking wet when I'm sleeping, and then I get chilled or a sore throat after, and during the night. And I was wondering, is that a concern? Because I'm thinking maybe I'm sweating out all my minerals.
Yeah, sweating is not good like that. Have you ever traveled to malaria countries?
A long time ago.
I mean, it just leapt to mind.
Well, actually, not that long ago. I guess about 5-6 years ago, I was in Mexico, and about 24 years ago, I was in Malaysia.
Well, does it feel like when you went through menopause?
Oh, I'm just at the. I've been almost a year without my monthly cycle.
Did you ever have hot sweats?
Yes.
Are they like that?
No, I just, it's mostly from my head and around my neck and chest and shoulders and kind of between my shoulder blades at the back. That's where I get really wet. And I was just sitting here and I was wondering if it was, I was just wondering about it because it's kind of annoying.
Oh, yeah, right. Yeah, I mean, I don't know what to say about it if it doesn't seem hormonal, but...
I do, Carolyn. Take our products, magnesium, anyways.
No, well, Louisa does, absolutely. She's
doing the magnesium?
Absolutely.
Okay, then the drops.
And you're doing those still, aren't you, Louisa?
I hadn't been doing the RNA drops. I kept getting swelling in my legs. I put them down to really smaller doses, and then something happened, and I stopped taking them. My bottles are older because I couldn't take them for quite a while.
Right. I mean, if they've been in the fridge, you can still take them. Maybe just take 1 or 2 drops. Nothing else comes to mind rather than, other than you checking to see if you have some sort of infection, because the sweats are meant to burn off organisms, or there's some sort of hormonal issue. So you could have your hormones checked and check for infection. That's the only thing I can think of.
Okay, well, I still got that jaw infection going on that hasn't been able to be cleared, and the blood pressure is still high. But I saw a naturopath when he told me the blood pressure would likely come down if we were able to get rid of the infection. And then
well, if the infection is in the dry area, then, the area may be coming to a level where it's creating heat around the jaw to try to burn off the infection. If you still have that jaw infection, I didn't realize that.
Oh, okay. Because, it's mostly at night. I mean, I get what's considered hormonal hot flashes during the day sometimes.
Right. Okay, here's what I would do. If your body is trying to give you this head and neck fever reaction, then you just start using a lot of hot compresses on your jaw during the day and create your own little daily fever to see if that shifts anything and, starts pulling things out, and see if that diminishes the night sweats. And, I know you're doing all kinds of things for the jaw infection, but have you worked with silver? Have you done clay poulticing inside your mouth? Those are the two things I'd be looking at.
Oh, okay. I hadn't thought of the clay poultice. I had gotten some clay, and I was going to do a clay bath, and then when I realized there was a lot of work involved with the getting filters and stuff like that, I didn't do it, but I didn't.
Oh, well, with clay, I know that's crazy. What I tell people with the clay is just take about half a cup of the dry powder, put it in 32 ounces of water, blend it up, and that's all you use in the bath. So it's all blended up. It'll go through the drain without a problem. But, yes, do clay poultices. You can do them outside your jaw. You can even hold, a wad of clay, wet clay inside your mouth. You can blend it up in a blender and make it real thick. But, work on all that. If your head and neck is starting to sweat, if you still got the jaw infection, that's where it wants you to work.
Oh, okay.
Carolyn, Go ahead.
Sorry. I had been getting concerned that it could be MS or something with my feet cramping up. But
no, don't go there. You've got enough to work on that you don't have to create. You don't have to have another disease. We'll stay here with the jaw infection.
Are you taking Remite?
Yes, they did.
So she's doing all this, Carolyn. Could this be a unique response?
Well, what it is, Bob, is Louisa has had this jaw infection forever, and now her body is healed enough on different levels so that the focus now is on her head and neck. The sweating and fever are there to try to get rid of this, and I'm telling her ways to help, facilitate that.
Well, that sounds good.
Told me there. Okay. I was told there was osteoporosis in the jaw. I don't know if it got any further, but...
Well, yeah, of course there would be with all that's been going on, but don't let that bother you. They'll give names to all kinds of things. If your bones for osteoporosis are compared to a 30-year-old. So we're all going to look like we have osteoporosis. And there's nothing they're going to do for you other than put you on Fosamax, which totally rots out your jawbone. So, don't even go there. Okay, you said you had two questions. What's the other question?
The other question, I'm spreading my Remite and Remag throughout the day with some sea salt. I'm taking lower amounts of sea salt in the water because I stopped drinking when I put a lot in. I put about 1/8 of a teaspoon of sea salt, 1/4 of a teaspoon of Remite, and 1/2 teaspoon of Remag in a cup of water.
Right.
And I like the taste of it, and so I drink it like that all day long whenever I'm going to drink. I usually have a 16-ounce bottle, and I'll sip that until it's gone, and then I'll get in and make another one. And that, so sometimes I put a little less in, sometimes I might put a little more in depending on where my body's at. And then I was wondering, should I be having periods where I'm drinking just straight water?
Not necessarily.
No. Okay.
No. I mean, you're doing it just fine. Water's meant to have minerals in it, so you're just drinking good water.
Okay. Yeah, I've been drinking alkaline water, too. I got my machine going again, and my body really likes that. So.
Oh, good. Okay.
And I got tested on the Remite and the Remag, and they told me just keep taking it. Your body wants lots of it.
Good. Yeah, most tests turn out that it's very positive for people. Okay, Louisa, well, let us know how this goes. Email Ginny and let us know how the, enhancing the heat and the fever and the pulsing around your jaw, how that works for you, okay?
Okay. What do you for a poultice? Do you just wet the clay and stick it in your mouth and pouch it up?
Yeah, exactly. Yeah, just mix it up with water. It'll be hard to mix, but make it really thick and just bunch it in there like a side of tobacco.
Is it a problem if some of it gets swallowed? Because I guess it's
no,
okay.
Not at all. It's clean dirt.
Hey, Louisa, do you like your first lady?
Huh?
Do you like your first lady?
Come on, Bob.
That's Justin Trudeau's wife, yoga teacher.
Oh. I haven't been paying too much attention to politics.
There you go, just like the U.S. Okay, thanks, Louisa. Bye-bye for now.
Thank you. Take care. Bye.
Bye. Look at you,
okay,
Bobby.
Carolyn, let's go to area code 203. 203, you're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Sandra Burr.
Hi, Sandra. Go ahead.
Hi. I adore you, Jenny, and Dr. Dean. I'm so glad to speak to you. Last time I spoke to you, I was very sporadic. My voice was. The Remax really helped. It's only been 40 days, and I'm starting to feel better, and I'm starting to take less Advil. And you can hear by the sound of my voice, I'm sounding so much better.
That's wonderful. Very
really, I can't thank you enough. And Jenny's wonderful. Now, look, I wanted to also ask you a question. Today, a woman's walking the dog down the street. 4 pit bulls come out from a house and attacked her and her dog. Her dog is half pit bull. I saw the whole thing, and then the woman got the dogs off of her, and by the time she made it 2 doors down to my house, to my front yard, I said, "Are you all right?" And she collapsed in front of me and was sitting, saying she thought she was going to faint, so I ran in the house to get her water. And as I handed her water, her dog, who was all upset because of what happened, bit me on my inner thigh. I've got 2 good holes on my inner thigh.
Oh,
The woman took off. I think she was afraid I'd sue her or something. I wouldn't. I understand the dog. I asked her, the dog had his shots, and she said yes. So I went over to the clinic, and they washed it off and told me to wrap it up. Now, that happened at 1 o'clock. It's still oozing and bleeding a bit. I keep changing the bandage because the 2 puncture wounds. I guess puncture wounds tend to do that. He said you don't really need to be on the penicillin or antibiotic, but I think we're going to put you on dioxycyllin. At first he said Cipro, and I said, after talking to you, I knew to say no. And then he said dioxycyllin, and I said, well, all right, write out the prescription, but I don't know if I'm going to pick it up. So I said, I'm going to call Dr. Dean and get the straight on this. I'm probably doing right by not taking the Cipro. I went over to the health food store and immediately bought the silver, the very silver you talked about. Took 2 teaspoons of it, and I keep putting the silver on the wound itself. Now,
perfect.
Mm-hmm. Okay, so I did right? Not getting, because you remember it was the ampicillin, the reaction to all that made it so that I was in such extreme pain. It just
Now, so that's perfect what you're doing. I should say that's what I would do. I don't want to prescribe for you, but do you have any clay around to put a poultice on that?
I do not have any clay. No, I do not. I'm not. I was listening to you talking about the clay.
Do you have any bread? Do you have any bread?
Yes, I do. I have some.
Well, what you do any type of bread. What you do tonight, because you'll be asleep and you won't be able to, put the silver on. So when you go to bed, what you do is cut out a piece of bread, the area, the size of your wound, and just wet it a little bit. Don't make it runny, but make it a little more than damp. Using it like a wound. Put that over the wound and wrap it up so that it doesn't leak, and that'll draw out if there's anything in there. And if you think it looks better the next day, then do the silver. Maybe put the bread poultice on later on in the day. Do more silver orally and locally, and then go to bed with the bread poultice. If it's not looking better in the morning, go and get some clay at the health food store and put on a clay poultice.
And this is any kind of clay? I mean, is it a particular clay? Is it a...
I don't know what the health food store would have. What you'd have to ask them, is there a clay that I can use to put a poultice on a wound? And they should be able to tell you.
Oh, good.
Okay.
How many teaspoons of silver does one take to avoid having to take that deoxycyllin, whatever they want to put me on?
Well, usually it's about 1 to 2 teaspoons.
Okay.
3 and 4, even 5 times a day. For acute possible infections, then you use a lot of it. 1 to 2 teaspoons, 4 or 5 times a day, and we're off. So keep Ginny posted, okay, Sandra?
I will, and I'm so happy to talk to you. Thank you. You have a wonderful, wonderful day, and thank you for helping me.
Thank you. Bye-bye. Bye,
all right,
Ginny.
That's the show, everybody. Thank you. Bye, Carolyn. Thanks, everybody. Bye, Bob. Thanks, Bill.
Thank you, Bob. Thank you, Bill. Thank you, listeners. Yay!
Wow. AchieveRadio.com. Till next time, so long, and thanks for all the fish.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This